Hi, I'm Dr. Dave Wendell from Natural Health and Wellness Center, and today I want to talk to you about questions to ask your doctor regarding cholesterol. See, most of us go to the doctors, we get our blood test, and when the blood tests come back, the doctor says, guess what? You need some cholesterol medication. Well, it's time we really start asking some good questions. The first question you want to ask is, why is my cholesterol high? Right? Because what determines what high is? The question you want to understand is it due to your diet? Most doctors, not all, but most will say, well, yeah, it's dietary related or hereditary. Well, we know it's not hereditary. Epigenetics have proved that it's more due to lifestyle habit, not genes, that we have high cholesterol. But is it due to your diet? See, the doctors will tell you yes. And I see it through my family, my patients, that their patients are being told, get off the animal products. You got to get away from the eggs and the meat and all the things with cholesterol in it. That's mythical. It is so mythical, there's no study anywhere to prove that that's true. You see, what raises cholesterol in the body is making the body deficient in cholesterol, and then it'll go up. So how does that happen? Well, we eat what I affectionately call white trash. Bread, pasta, cereal, biscuits, muffins, pancakes, waffles, donuts, bagels, cookies, cakes, candies, pizza, tortillas, empanadas. When you eat those things, white trash, white flour, sugar, that's going to cause the body to raise your cholesterol level. And you start thinking, well, why? Well, let's think about where cholesterol is made. Cholesterol, we know, is made in the liver. 85 to 90% of your body's cholesterol is made in the liver. If your diet is devoid of cholesterol, you're going to cause your liver to work harder. And so it's going to make more than what may be necessary. But also, if you're eating that stuff, the white trash, you're going to cause an inflammatory process in your body. And with inflammation, cholesterol has to go up because cholesterol protects the body, forms a barrier against inflammation in the body so that you don't have a process of inflammatory disease. So if cholesterol is on the rise, you can look at it and say, am I causing inflammation in my body? Look at what you're eating, assess your diet. But those are just two of the questions you want to ask. You also want to ask your doctor, what does the significance of the years 1984, 1997, and 2013 have with cholesterol? Now, your doctor should know that in 1984, they lowered a good cholesterol to 240 in a way to sell more drugs. In 1997, they then lowered that to 200. Of course, why? To sell more drugs, because as we lower cholesterol as normal, we create more sick people. In 2013, a good cholesterol reading went down to 170. Above it, no good. Mythical. But the reason for that is 52 million more people, Americans, are now eligible for drugs. So are they really doing it for our health, or are they doing it for drug sales? And so we have to ask these questions. When we look at cholesterol, if you fall below 160, it makes your body more susceptible to cancer. Be careful. Above 330, you're more susceptible to heart disease. That's what the study shows, Framingham study, the only study so far that really tells us about cholesterol. And so as we're looking at this, when our cholesterol is falling, we have to think, well, what does cholesterol do in the body? It's made in the liver. The liver then puts cholesterol into the body in the form of hormones. For vitamin D, it's used for. It's used to cover every cell membrane. It's in there. Covers our nerves, our brain. All this stuff is made of cholesterol. If we start artificially lowering cholesterol with drugs, we're tearing apart our brain. We're tearing apart the sheath that covers the nerves and the nervous system. We're tearing apart our muscles, chronic pain, memory loss, and these things can become permanent and really doing a job on our bodies, not to mention liver disease because of the drug. And so be careful. Ask these questions. You also want to know, what is good cholesterol? What's a bad cholesterol? See, you're going to hear a lot of times that, well, good cholesterol is HDL, bad cholesterol is LDL. And that's not true at all. HDLs are high-density lipoproteins. LDLs are low-density lipoproteins. The low-density lipoprotein carries the cholesterol from your liver and brings it out to your body. Right? Makes sense. That's what LDLs do. So when LDLs are on the rise, that means more cholesterol is going out to your body, most likely from an inflammatory response. That's not a bad thing. HDLs take that used cholesterol, compress it, dense, high density, and bring it back to the liver to get reprocessed or filtered out. And so there's a process in there. If we see that LDLs are rising, we have to think there's an inflammatory process in the body. If we see that LDLs are rising and HDLs are starting to fall, we have to think that there's a chronic inflammatory condition in the body. So you really have to look at the physiology and the relationship of cholesterol, of HDL and LDL, not just look at the number and say, oh, too high, too low, you need drugs. The other thing, oh, where does cholesterol come from? We did that, that's from the liver. And inflammation. Inflammation, I talked about a few moments ago, but it plays such a significant role with cholesterol. And so we really need to clean up our diets, use what we call phase 1 or phase 2 food plan to decrease the inflammatory response in your body to get cholesterol levels down. I'm Dr. Dave Wendell from Natural Health and Wellness Center, and we want to be your inspiration for healthy living.